Awesome. Well, welcome everyone to our Advocating for Fertility Benefits with your employer. My name is Christina Iannetzos. I'm an emergency medicine physician and one of the board members from Colorado Fertility Advocates. We are excited to have you guys today to kind of talk about, next steps and how we can advocate for benefits. As you guys may know, I myself helped Colorado Fertility Advocates move a bill last year through our legislature, and that did not result in benefits for everyone. So there's a lot of us here in Colorado, myself included, that do not have benefits. So, there's different ways to advocate. One of those things being, advocating at the federal level, asking for fertility benefits at the federal level for certain insurance companies that are regulated by our federal government. There's a state which only regulates certain entities. And then of course there's local, where you are advocating for yourself and you're empowering yourself to ask your own employer for those benefits. So we have some awesome advocates today and some really fierce advocates. So I'm really excited to introduce them to you. And the first person is Molly Walker. So she is a co-founder of the Tennessee Fertility Advocates. She's an alumni of the University of Memphis, and she serves as one of the city executives at Landmark Community Bank. Welcome, Molly. Molly is driving right now from doing some awesome advocacy work in Tennessee, but she is really excited to be with us.
I'm actually parked. Can y'all hear me? Can you hear me okay? Yeah, okay, cool. I'm actually parked, but if you hear like a lot of noise, that's traffic next to me. So, but I will not take a lot of time because things with legislation happen so last minute, and I really expected to be at my computer desk with the camera and like so excited to share a lot of things. And as luck would have it, we were actually fighting a bill in Tennessee today, and we'll continue on. It got rolled to next year, long story, but this is what advocacy looks like. It is, it's uncomfortable, it is hard, it isn't easy, and it started, I think a few things that I would say is advocacy started within me. Like advocating for myself at the doctor is where I really started finding my voice, and then started realizing, you know what, like my voice matters. And slowly I worked at a large company who didn't offer infertility benefits and still doesn't, but they offer adoption coverage, which is great. And they offer money for kids to go back to school, which is fantastic too. But there's no coverage to build your own family. And so my journey, it was years long. I had a blood clotting disorder, multiple miscarriages, but I didn't need extensive invasive procedures. I just needed treatment for my disease. And 97% of those that go through that only need simple procedures that aren't covered because it's infertility. So I just started sharing at my employers and was on a board that was able to raise awareness in my voice. And, I transferred jobs, and long story I'd say is just through that time, I learned what it meant to actually be an advocate for yourself. And I always think, what would I have done differently that I know now? Obviously, finding this Colorado Fertility Advocates led us to start Tennessee. Christina and Representative Tipper in Colorado really helped pave the way for Lauren and I to start this group in Tennessee, in a red state. But I know this call is not about that type of legislation and advocacy, but I think it's important to know how all these pieces and everything that you'll hear all really matter. And one's not more important than the other. Like, we are advocating for the next generation, whether it's your employer, we are advocating for ourselves. We're advocating for things that might not even benefit us, but that's what we're called to do. And so if you're on the fence about sharing your story or where to start, I know many women on this call that are going to speak have such incredible tips, but I'm just coming to you from someone who now I do have two beautiful children, and advocacy matters. And this is what it looks like. And it's not easy. It's hard, but it's so worth it. And so, yeah, I think those are just a few little thoughts that I wanted to plug in as y'all get started. Thank you for just letting me be on, and sorry I'm in the car.
Thanks, Molly. We really appreciate you being on. And I hope you have a safe drive home. Thanks for jumping on, even
Thank
though I know
you.
you're running from one legislative event to another.
Thank you.
Well, next up we have Ms. Sarah Barnes. Sarah also works with Tennessee Fertility Advocates, and she works in marketing with the ALSAC, which is the fundraising and awareness organization for the St. Jude Research Hospital. So we are very happy to have you. Thank you.
Thank you guys so much. I'm really excited to be here, Christina. Thank you for the invitation, and hi to everybody. It's good to see your faces, and I hope I can share just a little bit of knowledge with you guys. It'll hopefully help you in your journeys. My story with family building really starts 4 years ago tomorrow. Actually, it will be our 4-year anniversary. My husband and I actually started trying to start a family right away, and we just knew all along we wanted to have kids. So this was something we just wanted to jump right into. Unfortunately, we did not get pregnant right away. We spent about a year trying before, the light bulb kind of went off and we realized, hey, maybe we should talk to a doctor. My husband actually had testicular cancer in his 20s, and I had a couple non-cancerous tumors on my ovaries in my early 20s. So we went to a specialist right away just to make sure that our past medical history didn't have any, long-term effects on our infertility. So we were referred to a great clinic here in Memphis that we absolutely love and adore. And we went through all of the tests, like I'm sure most, if not all of you have. And we checked out totally fine. My husband likes to brag that he checked out more than fine, but we were diagnosed with unexplained infertility, which was, it's good news because there's nothing wrong, but it's also frustrating news because you don't have anything specific to treat. So we decided to keep trying for another 6 months. And when we did not get pregnant, we made the decision with our doctor to move forward with IVF. Now, I will say my employer, ALSAC, is well known here in Memphis to have outstanding benefits, along with St. Jude Children's Research Hospital. We have excellent health care. Like Molly's company, we pay for a portion of adoption, we reimburse education, but unfortunately, fertility coverage was not part of our healthcare plan. Nevertheless, my husband and I decided to move forward because we knew, that we wanted a family. So we spent about 2.5 years going through IVF. We went through 2 cycles. We had 4 transfers. We had 2 chemical pregnancies, 1 failed transfer, and 1 miscarriage last in the fall of 2020. And I don't need to go into detail, but of course, that was just a really, really tough time. We had ups and downs because we would have, got to receive the amazing news that we were pregnant on 3 separate occasions. And then on 3 separate occasions, we were told that we were no longer pregnant. One of which was at an ultrasound where we were expecting to see our baby for the first time. So there is a lot of trauma in that. I know you guys are familiar with that. And it was just 2.5 years of just a really hard time, an emotional roller coaster. I think that we grew really, really close as a couple during that time. We really learned how to support each other. I learned how to lean on my friends and family. We had a lot of people praying for us. I have friends, close friends that have also gone through infertility, which just tells you how common it is. I mean, of my close-knit group of 6 girlfriends, 3 of us struggled with infertility. So, it's great to have that support system, but it's a club that you would rather not be part of course. So during the course of the 2.5 years that my husband and I struggled, I started asking my employer about fertility coverage. This started about a year in when we were really almost through our first cycle of IVF. And the conversation really just started with me sending a note to HR. It was that simple. And I just said, hey, this is what I'm going through. And I'm just curious, have you guys ever considered coverage? And just put the question out there. And fortunately for me, my employer was very receptive to the conversation. And while they had not considered this in the past, it was something that they were willing to look into. So that was enough to kind of give me a little bit of hope at the time. And the advocacy really took off from there. So I spent a little over a year working with HR to push for this coverage at work. There were a few things that I did that I would recommend to those of you who want to, try this with your employer, which obviously I highly recommend. I was very persistent in just checking in with them. Hey, have you had a chance to look into this? Have you considered being really persistent and being the squeaky wheel, as they say? I also shared a ton of data with them in terms of not only how common infertility is, but its effect on workplace performance. I mean, you guys know, like, when you're going through infertility, like, there is not a part of your life that does not bleed into. Like, you're thinking about it at work, you're having to take time off to go to doctor's visit. It affects your finances, it affects your marriage, it affects your relationships. I mean, it is impossible to not have it be just a huge source of, brain space. I shared with them how fertility coverage has a tremendous effect on employee retention, and just really tried to educate them, since this was something that they had not looked at in the past. I also spent a ton of time talking to my colleagues, which at times was a little bit uncomfortable. This started with me reaching out to probably 3 or 4 people that I knew were also going through infertility, and just saying, hey, we've talked about this. I know you guys are struggling too. This is what I'm doing with HR. Can you kind of start spreading the word, talk to your leadership, et cetera, and just really using those relationships and trying to rally others around this advocacy work. And then I got a little bit bolder and reached out to people that I was not necessarily friends with, but people in working groups. So people that I worked with that did not know my story. And I just said, like, hey, listen, I'm reaching out to you because you are someone that I have, obviously we work together. And I think that this is something important that ALSAC needs to pursue. And sometimes that email would get forwarded to entire departments, which meant the story was floating around an organization of 1,500 people, which honestly, halfway through my IVF journey and about $35,000 in, I was like, I don't care. Like, I'm willing to put myself out there, because I know that if this is something I'm struggling with, I know that 1 in 8 couples, sometimes 1 in 6 couples, are experiencing this too. And I knew of my colleagues that were not only going through infertility, but could not pursue treatment because of the cost. We were in a very fortunate position to where, did I love spending all that money with IVF not being successful? No, I did not. But we were able to do that. We were able to pursue that treatment. And I knew of so many others that were not. And so I was okay putting my story out there. So my kind of Hail Mary of my advocacy work came in the fall of 2020. I was fortunate to connect with Molly, who you guys just heard from, and the work that she was doing through Tennessee Fertility Advocate. So she and I connected, which like lit even more of a fire under me. And she was able to connect me with just more wonderful people that were, fellow advocates, like Dr. K, who is also on the call now, but also she connected me with a company called Progeny. And Progeny is a fertility insurance company that provides incredible coverage to those of us who struggle with infertility. So I connected Progeny to my HR team. I was just like, here's his email, send him a note, see what he says, and really like nothing to lose, right? So I got the two of them in contact, and then was able to hear from my HR team that they were recommending coverage to my CEO for 2021. So that was great news. Of course, it was just a recommendation. So really all I could do at that point was pray that it would go through. We had just had our miscarriage. So my husband and I were feeling honestly pretty hopeless. Our doctor was really puzzled as to why we miscarried, why the pregnancy was not, ended. And so my husband and I were just in this place of like, at this point we had spent $50,000 out of pocket, all of our, savings. And so we were really at a loss in terms of what we would do next if this coverage did not get approved. So you better believe I was praying my face off, constantly just praying that our CEO would approve the coverage. So I sent him an email. I would say it was late September 2020, sent him an email and just said, listen, I know this is going to be recommended to you. This is my story. I'm boldly asking that you approve this coverage. And I was able to co-sign that email with over 100 of my colleagues who also supported the coverage. Of those people that co-signed with me, I would say roughly 30 of them either are currently struggling with infertility or have struggled in the past. So I had people saying, oh my gosh, Sarah, like we had our twins 16 years ago because of coverage that my wife had through her employer in Atlanta. Or, my family is complete now, but we struggled for years before we had, our child. So there were people that supported the coverage because they had been through it. The rest of those people, so the majority of those people, did not personally struggle with infertility, but they saw the value in the coverage and they supported it and they were willing to sign their name to an email to the CEO. So I sent that email in the fall. And in November, we had a huge all hands town hall meeting with the entire organization where our CEO announced that we would have coverage through Progeny starting in January of this year. So this was amazing news. You guys better believe I was like sweat crying during the announcement. And had the chance to thank our CEO actually during that call. And words cannot express just the gratitude that I had for not only him, but just my partner in HR and just our leadership seeing the need and doing something about it. So I am just like forever in gratitude that the decision was made to have that coverage effective in January. It's incredible coverage, like I said, through Progeny, which means that as of January, I know of so many people that are already pursuing treatment. One of my best friends that I work with, it just started the IVF process a couple of weeks ago, and she and her husband had been waiting until either they had saved enough or until we got coverage. So she is finally able to start trying for a family. And there are several stories like that. So it just brings me such overwhelming joy just to think about all of the people that I work with who are now able to start trying for a family. I mean, you guys know, like, it is, fertility treatment does not guarantee that you will have children, unfortunately, but the fact that this coverage is in place now and that financial barrier is not there for 1,500 employees if they need it is just awesome. So I would just say, be brave. It is hard to put yourself out there, especially with something like infertility, but 1,000% worth it. There are others who will, from the woodwork, I promise, that will say, oh my gosh, me too. I'm so glad you spoke up. I cannot tell you guys how many messages I got from people that just said like, I'm with you. I'm going through it. It sucks. I support this 110%. So be brave. I just encourage you there. Also, be persistent, but be patient. Our HR teams spend a lot of time evaluating healthcare benefits every single year, especially in today's climate. You guys know that healthcare is like out of control. So just be patient with them, but stay on their radar for sure. And then lastly, I will say just familiarize yourself with the data that's out there as it relates to fertility coverage and how it impacts employees for good, and share that, because if your company is a data-driven organization like mine is, that is going to be just as valuable as the stories that you share. So those are the tips. Don't give up. I promise it is worth it. And I am here anytime if you guys ever have any questions. This is something I'm passionate about. And so I would love to be able to help you guys with your advocacy efforts at work.
Thank you, Sarah. Thanks for sharing your story, and what a remarkable feat to be able to say that you have been able to provide coverage to 15,000 additional employees. Like, you have made such a difference to so many people's lives if they need it. It's just remarkable. So, and we really thank you for being here and sharing your voice and offering all of us to email you all of your tricks of the trade.
Do it. Bring it on.
Awesome. Well, next up we have Dr. Erica Kay. So Dr. Erica Kay is an assistant professor of the Department of Oncology, Division of Quality Life and Palliative Medicine at St. Jude Children's Research Hospital. I met Dr. Erica Kay after she wrote 1 in 4, The Importance of Comprehensive Fertility Benefits for the Medical Workforce, and was completely inspired by her, and actually use this in our own fertility advocacy here in Colorado. So we are so excited to have you on.
Thank you. Can you hear me? I'm so glad to be here and to see so many people who are interested in this topic. So I'll very briefly share a little bit about myself and then just walk through the, I think, 3 or 4 key steps that led to our successful advocacy within our organization. I am a medical physician and also a researcher, and knew nothing about infertility when I started my training. And I think that's a very common experience for women in science and medicine who defer starting a family during years of grueling training, and then discover infertility and often have no coverage during an intense sort of scramble to try to start a family. And so part of my mission is to try to raise awareness for the many young women that I now mentor in science and medicine. My husband and I have struggled with infertility for now almost a decade. We've gone through a number of IVF cycles. We've had 5 pregnancy losses and a number of just terrible medical complications. We are so lucky to have my elder daughter through IVF, who's now 5. And that was a scary pregnancy where we lost her twin in utero, but she is a real fighter. And then we adopted our younger daughter through open adoption. She's about almost 2 in the summer. And so we're very grateful and lucky. I did my medical training, medical school, and then pediatrics residency at Harvard. And so I took for granted the fact that I was in a state with a mandate for fertility coverage, and didn't even realize it or fully appreciate it at the time. And so we were very lucky to have our first IVF cycle entirely covered during that part of my medical training. And then I was recruited to St. Jude to pursue combined subspecialty fellowships in hematology, oncology, and hospice and palliative medicine, and was just shocked and devastated to realize after committing and already coming to Tennessee that we would have no coverage. And so just try to start a family would be entirely out of pocket when we were making very little money as trainees. And so the first layer of self-advocacy, and I like what Molly said, because I think that you can't be a successful advocate for others until you gain your voice and grow confidence in advocating for yourself. And I will be the first to admit that that took me years to grow and feel empowered to self-advocate. But I started by writing anonymously in the annual survey. And I think almost every healthcare organization has this, and a lot of businesses have it. They'll send a survey once a year about, like, you know, in medicine, they're trying to get onto like US News and World Report and Glassdoor, and you're trying to be like the best business, right? So it's an opportunity to say what you like about an organization and what is lacking. And so that was sort of my catharsis each year. I wrote an essay about why fertility coverage was important, and I just wanted that to be documented. But I think one voice doesn't move a needle as powerfully in a silo. And so once I was a few years from sort of the trauma of IVF and serial pregnancy losses, I regrouped and I decided to write to HR and sort of share my story and explain why I thought fertility coverage was important. And I think that also doesn't move the needle very much, but it opened the door for conversations, and I think is an important first step. And then I think several people have said this already, but data matters. It matters a lot in medicine and science, but I think it matters to leadership across all industries, way more than personal stories. And you could argue that that is silly logic, but I think it's pragmatic truth. And so I sat down and I compiled all the data that I could get my hands on. So I went through Resolve, which has a repository of information. There were several states, Massachusetts being one of them, that had like New England fertility organizations and networks that had information. There's not a ton out there, but I compiled everything that I thought could substantiate a comprehensive and compelling argument, focusing on the adverse outcomes when fertility is untreated. So there's some data that suggests that rates of depression, anxiety, and other mental health disorders are as high in men and women with untreated infertility as they are in men and women with cancer. So recognizing it as a very real medical disease with very real, measurable adverse health sequelae that matter to businesses because they need their employees to be functional and well. And then I pulled data looking at cost savings for large organizations. There's not a lot of data, but there is some that I think sparks a conversation, showing that when you give men and women equitable access to the treatments that they need, they make smarter decisions for themselves and for their fetus. And one practical example of that is that women who have coverage for fertility treatments are way more likely to implant one embryo at a time. And that actually translates into very real downstream cost savings, right? Because anyone, so I'm pediatrics trained, so anyone who goes through NICU rotations knows the devastating consequences of premature delivery, which are way more likely when you're carrying multiple gestation. And so I sort of talked through the ways in which coverage actually can translate into downstream cost savings, and then talked about recruitment and retention, which I think are very real and compelling stats for organizations, and centered all of it in the fact that a number of industries, large and small organizations, have started offering fertility coverage not because they're selfless, not because they're compassionate, but because they know it's smart business sense. And healthcare is, I think, way behind industries like tech and other business and corporations. And they're once a year, there's a group that puts out, they do a national survey and they put out all the employers that offer fertility coverage. And so I compiled that and I showed the institution, everyone who's offering it, and saying they're offering it because it's smart business sense for their organization. And so I put that into about a 3-page letter that was very data driven and organized, and I sent it to the CEO of my institution and a couple of other like top brass. And I wish I could say that was like it and it worked. I think unsurprisingly, when you're one voice and your voice is female, against a leadership hierarchy that is old and male, that doesn't usually move the needle. But the fact that I think it opened further conversations with HR, because I CC'd the director of HR on the email. But I think when the CEO didn't respond to my email, it also galvanized me, because I was angry and frustrated. And so I said, I've done all this work. I have a very compelling argument. So I submitted the argument to the New England Journal. And that's an important platform. You can sort of debate the merits of why should the exact same content matter more because it's stamped in like the most prestigious journal. It shouldn't. But the reality is that it does. And so within healthcare, I think New England Journal is sort of the prototypic, most impactful platform you can have. I think there are other platforms in for business. I was like Harvard Business Review would be a very impactful platform. I think you can think strategically within your realm, but like, what is the most prestigious platform that it forces people to get attention? And I was fortunate that the New England Journal, I pitched it as a timely issue, but it was, I think, partly luck that they agreed and it was published. And actually, when they published it, they said, normal turnaround time is like 3 months. And I was like, I need you to get this out in 2 weeks because Christina's going to lobby the House. And so I'm going to need you to fast track this article. And so I wrote a second essay to their editor-in-chief. And I was like, I'm going to need you to break all the rules. And this needs to come out before this date. And that was compelling to them. I think everybody likes to feel like they're a part of social change or doing something important to impact wellness. And so they fast tracked the article so that like she could have it in hand when she went to the legislature. And I think that article made a big difference. And again, it was the exact, I literally, with very few tweaks, submitted what I had written to the CEO. But because it was stamped by the New England Journal, all of a sudden people listened to it more. And so I think that allowed us to gain momentum within the institution. And because I circulated that article, it also people came out of the woodwork. And so I knew already of a half dozen people who were struggling, but many more came out. And so then I felt more empowered to ask people to share their stories. And I had more legs to stand on, right? Because I had just made myself vulnerable and shared my story, role modeling that. And so I could ask other people to share their story to the degree that they were comfortable, and to do that in a coordinated effort. Because I think one person sends an email and then like weeks later, another person sends an email that trickles and it doesn't do nothing, but I think it's less impactful. And so I would send an email and say, okay, the 30 of us, we're all sending emails this week. Like we're just going to flood. It's just going to be a wave, in an organization of thousands of people, 30 emails, realistically, logically, it's nothing. This is not that much, but that's not what it feels like to the 2 or 3 HR people on the receiving end of those emails. It feels very overwhelming, and that's the goal, right? And so I think that's what that's the impact that you can have through just a little bit of organization when you say, okay, this is the week when we're all going to send our emails, and you do that a couple of times. And I think that in conjunction sort of with the long arc of conversations with HR and then the good timing of the New England Journal article led our organization to offer comprehensive fertility benefits for all employees. And I will also say, I think you can't underestimate the power of partnering with sort of local organizations and saying like, hey, this is what they're doing, because I think we leveraged that. There were several large organizations in Memphis already offering coverage that I pointed to, like, these are the major organizations of 30,000 employees doing it, right? But then people could argue, well, they can absorb it because they're so large. I was like, cool, here's the organization of 500 employees doing it. And then people say, oh, well, that's easier because there's fewer, right? And then you just bounce them right back to, it's helpful to have the spectrum. And then I think when St. Jude committed to having fertility benefits, it put a whole lot of pressure on ALSAC. And so that is really helpful then for advocates doing fierce, amazing work like Sarah. They've already laid the foundation, but then their CEO is feeling, I mean, I'm going to look really bad now if I can't match what a sister organization is doing. And so you need to leverage the work that people are doing also within your community. And then the last, second to last piece that I will say is work that people are doing at a state level matters enormously, because I think that coverage advocacy is a positive feedback cycle. And so if you can get more businesses within your community to offer coverage, you can go to your legislators and say, hey, look at who's doing this in the community, and they're doing it because it's smart and the right thing to do. And then if you can get it passed at a state level, that then puts a lot of pressure on the businesses that maybe aren't within the mandate to then catch up with what all of their competitors are doing. And so I think sort of from a big picture standpoint, ideally you need to be targeting both. You want to be doing advocacy at the organization level, and you want to be trying to organize to do advocacy at a state level, because those fights are inextricably linked and one really powers the other bidirectionally. And then the last point that I'll make is through the New England Journal article, I've connected a couple of times with AMWA, which is the American Medical Women's Association, I think is that acronym. So they're a partner, I think an offshoot of the biggest national medical organization, which is AMA. And AMWA is powerful to whatever degree large governing organizations are powerful. And they've decided this year to make fertility coverage one of their main missions. And so I spoke with their executive director yesterday, and they're very motivated to help put together sort of strategic plans and toolkits to help people advocate within their organizations and to take out some of the guesswork so that we can have sort of a, there's never going to be a one size fits all, but like, what's a roadmap? What's sort of a standardized process to empower people to overcome their inertia to be able to successfully advocate? And I've put them in touch with Davina, who's the founder of Fertility Within Reach, that is doing amazing work and has really helped us in Tennessee fertility advocates be successful with promoting our legislation. And Fertility Within Reach has put together a toolkit for employers to help understand why coverage is important and like the actual steps and how to do it. And they've put together a roadmap for advocacy. And so I'm hoping that in the coming weeks, Fertility Within Reach will partner with AMWA to help sort of put together sort of these types of tools that they can disseminate that people can use. So that is, I think, the highest yield information to share, but I'm glad to take any questions.
Thank you, Erica. We'll wait for questions at the end, but I can just say that whenever I have been advocating to my employer, I try and harness my inner Erica, because I would say she is my spirit animal. And basically, if I am not making someone uncomfortable about my requests, then I'm not doing it right. So I appreciate all of Erica's advice. So next up we have Dr. Katie Lolito. So she actually made it her mission while she was in grad school studying to be a neuroscientist, to change their employment options, or sorry, their benefit options. And so basically she made it her mission while she was at University of Michigan to go ahead and try and get those benefits. And she has been successful multiple times. And so we were super excited to have her with us.
Thanks, Christina. It is amazing to be on this panel and thinking back to when I was first diagnosed, wishing that I had had all of your experiences, because I have to imagine that there are people on the line today who are learning just exactly the roadmap they need. I mean, you guys have learned all these lessons that I was like, I learned that too. Why didn't we have something to guide us to, at this time? And we're so fortunate that Resolve has put a toolkit together for coverage at work and what you can do and the tools that your employer needs and you need to to be successful. And I guess where I come in is I've been at 2 different companies who I've got to add coverage. And I think all of these perspectives, all of us here tonight, are telling these really terrible, complicated trials to get infertility coverage, because it's not a recipe. You can't just go into every employer and be like, talk to this person, and that's how you're going to get coverage. It doesn't work like that. There are small companies they've got a part-time 1 person on HR. There are big companies and you don't even know who makes the decisions. And so Resolve can do all this work, and all of these other fertility organizations can do all this work, but where do you come in? You are the person who knows the most about your company. You know what they value. And so I just wanted to give you some tips about like what it is that you bring to the table, where like all these other resources that we have, they're going to get you so far, but what can you do with them that's really important? And part of it is starting with who is the decision maker. So at your small company or your large company, you're not just trying to get to HR. You need the person who is going to say yes to the coverage, and then find the people that talk to them who can influence that person. Like tell your story to the vice president or the president who talks to that person, whoever is going to influence their decision. The other part is finding your allies at work and in the community who have done this before. So coverage is it's infertility, but it's also other things. It's autism, it's weight loss surgery. It's all these things that like, you know, all of these coverages have been added before. Find out what has been added recently, how it got added, you know, and what were the steps that happened at your company to get those changed. And then you sort of know the roadmap that way. And sometimes it's your allies who will have those answers. So for me, it was at the University of Michigan, the union had added transgender surgery as something, so they knew exactly who to talk to, exactly what needed, they knew it could happen. And that was hopeful. And we also knew the sort of steps in the ladder that we needed to take. And then also find other people. So other people have said this, but there are other people besides you who are struggling, who need fertility treatment. Are they single parents? Are they the LGBT community? Are they people who, I don't know, have had cancer treatments? There are so many people. This is not just your issue, that also will support fertility treatments. And then in part of being what can you do is understanding how fertility treatment is in line with the mission of your company. So I also worked at a larger corporation, and they were very focused on sort of delivering these values to their employees. And it was very clear to me that in fertility, they wanted to be inclusive. They wanted to be a company that valued family and private life. And they had all these other great coverage, like somebody else mentioned, adoption coverage, all these great things. It was really in line with their already existing coverages. And so bringing it up in that sense, here's what you offer now, here's what you value, and this is why infertility coverage fits in there. So only you can know that, and you know that by working there and hearing the presentations from your CEO and what they value. And the other issue is understanding it from the viewpoint of your employer, and only you can understand their main concerns. It may be a cost issue, it may not be, it may be an optics issue. What is it? The other thing is only you know your employer's competitors. Get those competitors and say, do your homework and see what they have to coverage, or who does your company aspire to be like? What do they cover? Because you know that if you work at this company, and you are great, probably because you're here today, you're amazing, and they want to be amazing too. They want to attract and retain the most amazing employees. And so compare them to those kind of aspirational competitors and see what they're offering. And then go through your plans and look for things in your coverage that they already cover, like male sexual dysfunction, or autism, or bariatric surgery. These are things that are like infertility treatment, cost-wise, and also qualitatively. Their a quality of so-called quality of life would be categorized as quality of life to them. And so you can say you already cover these things. Here's why infertility is like those things. Pregnancy, birth control, sterilization. These are things that are all in the family planning spectrum that they probably already cover. So you can only find out those things if you work for the company. You have access to those documents. And I will just echo this, the squeaky wheel, like Sarah said, you have to be walking that fine line of enthusiastically spreading awareness and being annoying. And that's really the balance that's perfect with your company, staying on top of them, but then also letting the wheels of the institution turn. And I am just so excited to share this with you and be on this panel and support you guys in getting coverage, because we're part of something that's so important. All of us are here today and we've been getting coverage, knocking them down one by one. And just from this, it's just really hopeful to think about all of the other people who will get coverage from this.
Awesome. Thank you, Katie. We really appreciate it. And Katie has been successful in multiple fronts, so with the university and then switching to her large entity corporation also, where she was able to get benefits there as well. So we appreciate your wisdom and insight in all of these. And she has also been another person that I have texted and said, oh my gosh, I just sat in front of like a whole bunch of really important people and told them about my uterus and my ovaries, and I'm super anxious. And so she was like, yep, that's how things work. But ultimately in the end, it pays off. So our next panelist, I'm really excited to introduce Claire Adamsick. So she is a public policy professional that's based in Portland, Oregon. She served as the commissioner's lead staff on land use and recently has helped to advocate for family-friendly policies in the city of Portland.
Thank you, Christina. And it's been such a delight to hear from all of the experts who are here. It's a real honor to be here. I feel like what I have to offer is maybe more of a case study from the public sector perspective. So I'll probably cut out some of the pieces I wrote because I've learned significantly more in this conversation. And again, Amanda Rush, who's here, was a fantastic resource to me early on, and as the rest of you would have also been in this experience. So my personal story really briefly is that my wife and I knew that as a lesbian couple that we would need some level of intervention in wanting to form our family. So that part wasn't surprising, but then when that was coupled with, I guess, a little bit of, fertility issues just in terms of things taking more time and having to go sort of a more expensive route than we had anticipated, that threw us, and definitely went through, kind of share some of your experiences. Our older son, who is now 7, was conceived through reciprocal IVF. I was the egg donor and my wife carried. And then our younger son, I carried through IUI, and that was after 2 early pregnancy losses. So and it's funny because I remember in that kind of learning the term rainbow baby, and I didn't really use that for him, but he is 4 and he is obsessed with rainbows. He like sees them in every possible pattern. So that's kind of I was just sort of thinking about that as I was thinking about how they each, came to be in their own way and keep us on our toes all the time. So in my case, I, was sort of navigating privately, trying to get pregnant with our second child. And I was working at the city of Portland. I worked as a senior policy advisor for one of the Portland City Council members. Her name is Amanda Fritz. Lots of Amandas in this group, I think. And I, when I was, I was visibly pregnant in the workplace, and people who knew my family situation, either at that time or some later point, a few, asked me and approached me about resources. What was my path? Could they ask? And, asked for some local resources. I always recommended an acupuncturist that we were lucky enough to work with that was, really actually provided that mental and emotional support, but again, was out of pocket. It was really those conversations that made me realize that I was in a potentially very serendipitous position because of where I worked and who I worked for to advocate for change. And this was after I had come back from parental leave that I had enjoyed as a city benefit and had been working for Commissioner Fritz for 4 years before I approached her with this idea of looking into city benefits. And the commissioner was a retired mental health nurse who had advocated for different family-friendly policies, including paid sick leave, paid parental leave, which included for fostering, adoption, and birth and non-birth parents. So she also helped advocate for a transgender health policy, which recognized that a person's ability to embrace their gender identity and expression is medically necessary. So she basically was like, what took you so long to bring up this idea? And, I think it's almost when I'm hearing some of your stories of really this ground up advocacy, grassroots advocacy building in your workplace, and realizing the privilege that I had, again, because of where I worked and who I worked for, to kind of start at the top and then need to build a case around that. So realizing that was advantageous, and was appreciative of that in some ways. It didn't necessarily fast track the process. I think that there was that piece of making the case to human resources. There is a committee that's made up of labor union and represented and non-represented employees that work for the city. There's about 6,000 employees that work for the city, and they review the annual benefits plan. And as someone said earlier, they have a lot of benefits to consider each year, and so it was a bit of a slow road to sort of get this piece to the committee. And in the meantime, I reached out to Amanda Rush and thought, what are policies that, now that we have a little bit of traction, what can I provide to lend sort of background and additional research? Because the committee wasn't necessarily going to have time to do that. And so HR was somewhat helpful in trying to look at potential utilization rates, basically based on, if the city covered one or more IVF cycles. But it was what seemed to sort of be impactful, even in the absence of some of the data that we needed, was anonymous testimonials that I collected from employees through employee resource groups. So different people of color, affinity, and identity groups. There was an LGBTQ plus group, Portland or PDX, City Mamas, working moms, and which expanded to working parents group that said, we've been wanting to advocate for this for a while. So they shared personal stories. They agreed, I met with folks one-on-one, or they submitted things to me in writing. I organized, and kind of consolidated that testimony as a piece to share when the committee was considering. And basically they were considering, would they be able to back some type of benefit? Because it was at the point in their process where they were close to kind of sealing the deal on the upcoming benefits plan year. So what came out of that was they agreed, they said, we need a little bit more time, and we would like to form a subcommittee of this larger labor management benefits committee, and explore what our options could be for providing coverage that fit the city's core values around equity, in particular racial equity and inclusion. And so that was really, that piece and kind of that value statement was what made it a very easy sell, but also really influenced the subcommittee's conversations around how could all intended parents from all socioeconomic backgrounds, cultural backgrounds, be supported by expanded benefits. Certainly the cost of, and they did kind of, they scoped out benefit scenarios around, and I say they, I was a part of the group, but I got to sort of be a fly on the wall, and then I would pepper in questions once in a while. I wasn't a voting member of this group, obviously. And they would, they did explore what would it look like to cover one or more IVF cycles here, and they, again, limited data, I think, the cost benefit analysis piece, the health outcomes, right? There was some general information, I think, that Dr. K was talking about earlier that, I brought to the group. Some of the members of the group were very savvy. They either had their own personal experience or they had done work in this area. So they were great allies that brought things forward, and I didn't really need to say anything. But we didn't have data. You don't have data about what you think people might use. There's HIPAA laws, there's other privacy and regulations that prevent what type of questions you can ask your employees. And so, and there wasn't really, we could have conducted a survey, but how do you actually sort of anticipate what the cost would be to the city? As this conversation continued, the pandemic hit, and the economic impacts, influenced the city, though governments have been relatively, generally speaking, stable. Fortunately, they didn't let go of the conversation, but what they ended up adopting was a 3-year contract, and this was passed by City Council, which also heard testimony, both anonymously through me and through a couple of employees who were willing to come forward and speak at City Council, to make the case for expanded benefits. So the agreement was to do a 3-year contract with a third party sort of, I think some of you probably know like what these new groups are called, like fertility and family forming benefits groups that offer third party counseling and financial support, and that would support folks in any way they are looking at a path to parenting. So it would be inclusive of fertility, inclusive of adoption, inclusive of surrogacy, so that theoretically we're reaching all employees who are interested in, at least with some base level of support and a potential for discounts through partnerships that the contractor has with local Pacific Northwest based providers. So I had, really organized notes, and now I've forgotten everything after like being influenced by what everybody said. So I'm jumping around a little bit. I just want to make sure I get to a couple of the other things that Christina asked. I did learn, so I have since left the city. The commissioner I worked for retired at the end of 2020, and the policy was actually heard at her final council hearing in late December of last year, and was adopted by a new city council, not brand new, but 3 members were new in January of this year. And I reached out to the HR benefits manager, who, and again, so this is kind of we'll see where this goes. But the successful bidder is Carrot Fertility. I'm guessing many, if not all of you, are familiar with them. And they met, I was around when they were developing, the subcommittee developed sort of like review criteria that would move forward. And one of the big things was, sort of culturally specific services. And they really scrutinized the makeup. And this was after interviewing. So companies submitted they responded to an RFQ or RFP. And sorry, I'm not really in contracting. So we learned about the makeup of the companies and what was the ownership and what was the board structure and what percentage were identified as women, identified as people of color, were multilingual. And so, applying similar pieces, similar screenings, that is used for other city contract processes, equitable contracting processes, and it follows some policies that had been somewhat recently adopted by the city. So Carrot won that bid, and they anticipate a program rollout in July of this year. The benefits manager told me that they are developing I think they're calling it a family planning guide, or that was a title in progress, but it's to gather all resources available to employees in one place, which also includes some supplemental family mental health supports that are provided by another provider that had been, offering like employee assistance program stuff like counseling and other pieces that existed prior to this work. And the plan, so I asked about data because that was a big piece of like, at least at minimum, right? You're not going to necessarily with this money and with this program be able to cover a full IVF cycle that like other folks have been able to accomplish in other institutions. If This hopefully will allow, the plan is that Carrot will submit aggregate data on utilization. And, that will allow the city to capture data that is a little bit broader than what they could have previously obtained, related only to employees who seek a medically necessary, infertility diagnosis claim. So that will help the city make a case for expanded benefits, hopefully, and, based on real data and, of course, budget permitting, as the HR person told me. So, I guess I would just close with saying, folks have talked about, finding a champion. And I will even say that within HR, it was a program level person who I came to realize wasn't in a position of power in the organization, but I started realizing how much behind the scenes work she was doing to get the item on the agenda and convene people and get them my materials, and was kind of almost a silent advocate. I mean, I later thanked her. And then, I think the thing about when we talk about, and again, I still feel like there's pretty limited data on this. And if someone has more, I would love to see and read it. But in terms of, real data about the impacts of sort of the lack of fertility or other, sort of pathways to parenting benefits on employees of color, on single parents, on low income employees, when we talk about, hiring, recruiting, and retention for employees of color, which, is very big in public institutions, I'm guessing private as well. That's something to really think about in terms of the services that, and the benefit structure that we provide. If you offer IVF, are you does that meet your intent if you ultimately you only offer that, but then excluding folks from accessing any part of the process because it's a non-starter, right? So I think just how will we know that the employees that we have said we want to most center, and from that equity mindset, equity lens, how do we know that those employees are better off as a result of our work? So I think I'll leave it at that. And thanks again for the opportunity to be here. I'm really impressed by everybody's work.
Thanks, Claire. We were very excited to see everything that was going on in Portland. And so I'm very excited that you were able to join us. And thank you for the story and sharing with us your wisdom. But the next guest we have, Ms. Amanda Rush, has been instrumental in so many of our stories, has given guidance to so many of us as Resolve Senior Manager for Coverage at Work. So we're really happy to have you here, Amanda. Thank you.
Hi, thank you. I'm so happy to be here. Thank you so much for inviting me. Being on this call has been incredible because my favorite part of my job is talking to folks like these amazing ladies who are advocates and willing to share their stories. It is truly maybe the best part of my job, getting to work with all of you guys, and I'm hoping that everybody listening, that I'll be able to work with you as well. A lot of the tips and advice that have been given are I can only really echo. I like to go back to what Katie said about how every person's roadmap is a little bit different, and that's why with Coverage at Work specifically, it's a program that's aimed at turning employees themselves into advocates, because just like Katie said, nobody understands the company as well as you do. Nobody knows what your company's values are as well as you do, and you have that personal connection as a voice of someone that they want to retain. They want to recruit people that are more like you. And so what Coverage at Work does is we give folks the tools that they need to sort of put together their roadmap specific to where they work. We have a lot of templates and resources, and a lot of them are very data-driven, which we've heard a lot on this call as being super important. And we also have a toolkit specifically for employers that is heavily focused on science and data and research, because we know that they want information and you want the steps to effectively share your story and really where to start. and those resources, I'm really excited to say that we've been growing them ever since I started as senior manager for the program in 2019. Earlier this year, we released model benefits that were vetted by both medical professionals and human resources experts that are out there right now for both IVF coverage and fertility preservation that we're just really proud of. And then just the other day, as part of our National Infertility Awareness Week activities, we were also able to release a report that Resolve was able to commission from Mercer, which has some very exciting points of data in it. We had done something like this before in 2006. I believe our favorite data point from that was that 91% of employers who were offering coverage said that they didn't see an increase in premiums. The new survey that we fielded, that number has jumped up to 97%, so that's virtually all. But there's a lot of other great information in there that a lot of people have touched on, including the offset cost when you're giving your employees the ability to go about the medically appropriate treatment that they need, and not just what they're able to cover based on out of pocket ability or what is covered on the insurance plan. But the most important thing that I think Coverage at Work does is I do my very best to remain a resource. You have the toolkits that you can download, you have the research that we have available, but you can also come in and schedule a call with Resolve staff so that as you're going back and forth with your human resources department, I always like to say, if I don't know the information off the top of my head, I will definitely get it for you because I am surrounded by a bunch of really intelligent people who have been around Resolve for even longer than I have. But I agree. I agree with a lot of folks here about how it starts sort of with that one voice. But then it grows, right? So Sarah talked about being the person that brought this to her employer, and we find that a lot of employers don't even necessarily realize that there's a gap in their coverage until someone brings it back. But then that one person can inspire a lot of other people, and this Coverage at Work program is here to do that too. A lot of the times I'll get requests from someone, Christina knows this for a fact, from one organization, and then I'll get another email in and I'll email them separately and say, hey, can I connect you to you? Because there's strength in numbers. But even if you're one person just trying to figure out how you want to start sharing your story and advocating for these benefits, you're not going to do it alone because Resolve and the Coverage at Work program is here for you. All of these amazing advocates who have been willing to lend their expertise on this call are here for you. I saw that Barb Calora, our wonderful president and CEO, has dropped in the link for the Coverage at Work website and resources, and I will pop that in as well as my direct email address into the chat for anyone that needs it. But really, Resolve is just here to be a resource for you. The program is completely free for everyone to use. All of our resources are available. And I'm just looking forward to getting to work with every single person on this call so that everybody can achieve these amazing family building benefits and build a family the way that they choose.
Thank you, Amanda, and thank you for being a resource to me as well. I've reached out a number of times via email, and I've been guided through a number of situations. So I really appreciate having her as a resource. All right, our final panelist, Amanda was saying, so she is our VP of Sales at Progeny, and she is also has her own infertility story. So we are really excited to have you here and hear a little bit more about what you do.
Thank you so much, Christina. I appreciate it. And man, all of these people on this panel have really warmed my heart in the work that you guys are doing. It is so incredible. And I feel honored to be a part of this and get to do what I do every single day. And Sarah, congratulations on the work that you've done. So amazing. And I'm so happy that our company gets to serve all the employees of your organization. Super cool what you did. And everybody else also the same thing. I mean, I'm just honored to be a part of this as well. I'm coming at this from a little bit of a different angle. So at Progeny, I'm a vice president of sales, and my job is to work with employers, and I share the value directly with them of fertility benefits. and help get employees the coverage that they deserve. I came to Progeny about 3 years ago, and I came for a really specific reason and purpose. And that was, I had been in the employee benefits space for about 10 years. And I knew I wanted to do something that I was more passionate about. And my husband and I have been navigating infertility on a personal journey. And I wanted to combine those things and really take the pain that we had experienced and turn it into purpose for others. And to share a little bit about my journey, I won't go into great detail on it because it was really, really long. My husband and I navigated infertility for about 7 years. And in that time, went through so much loss and pain. We went through 9 rounds of IVF. We failed 9 transfers. We had an ectopic pregnancy, an endometriosis diagnosis, a failed donor egg cycle, a failed surrogacy cycle, and more failure than I could even know was possible. Somehow I had the courage to keep going, just like a lot of you on here have had the courage to keep going. And just 6 months ago, I welcomed my daughter, who was born through IVF. And it was such a long road to get to her, but somehow, some way, all of this has a purpose for me. And the work that I do means so much to me because of her and the legacy that hopefully I'll get to lead for her in the future. And if you want to hear more about my story, you're more than welcome to listen to a little bit about my story. I shared it on Progeny's podcast that's called This is Infertility. And I'm happy to share any resources that are helpful for anybody navigating this, because I know it is very lonely, as all of us know here on the call. So, I think what I wanted to share with you guys outside of my personal story is that, the power that people's voice actually has. So my seat is a little bit different than everybody here on the panel, right? I get to hear from employers once you advocated for the benefit. So that's a really cool place for me to be, is to get to hear directly from HR leaders when somebody comes to me and says, hey, my employee talked to me about fertility benefits. I'm interested in learning more about Progeny. And I'm happy to say in the 3 years I've been with Progeny, I've brought coverage to over 50,000 people across the US. And I'm so proud of that every single day, that there's people that get to have fertility treatment covered because of the work that I get to do. And as you guys know, not many employers covered fertility benefits just even 3 years ago. And we see this trend changing, as Amanda referenced. And we're looking at closer to about 2/3 of employers covering fertility coverage as we look forward to 2022. And I think that's so amazing just to hear that there is power in numbers of people actually asking for benefits. So I encourage you to continue to use your voice because I get to hear your voice on the other side all the time. And what I'll share with you a bit about the ask that you guys are making. So I think Christina asked for some pro tips. So my pro tips are kind of a little bit different, and that I get to hear people and what they tell benefits leaders and what they're asking for, right? And what I'll share is that working with insurance companies usually sucks. It just does. Working with insurance companies is usually not fun at all. And then if you're infertile and working with an insurance company, it also sucks even worse, right? And it does not have to be that way with fertility benefits at all. It does not have to be that way. The way that Progeny approaches fertility benefits is completely different than anybody else in the marketplace. And so I wanted to share, if you are going to your HR benefits team and making that ask for fertility benefits, I think there's 5 things that should be on that must-have list that your coverage has to include. That first thing on the list is access to all. Too many times I have looked at employers' SPDs that they limit the coverage to individuals. So making sure that the coverage you ask for covers same-sex couples, single parents by choice, people who need to preserve their fertility, making sure everybody has access to the benefit is so important. So that would be my number 1 criteria of any benefit that you ask for. Second would be to make sure an entire course of care is actually covered. So many times I see dollar cap maximum benefits that employers come to us and say, hey, we have this, we think this is enough. And I tell them very frequently why that's not enough and why it doesn't lead to successful outcomes. So making sure that your coverage really is comprehensive is so important. Always asking for fertility medication to be included within your coverage. People forget that. a lot of times. And, you know, average cost could be anywhere between $3,000 to $10,000. So making sure fertility medication coverage is included is so important. And then I want to always make sure that your coverage includes the latest technologies. So many times policies will not include coverage for things like genetic screening or PGTA or PGTM. So making sure that on that list of requirements that you provide to your HR director is the access to the latest technology so that you can seek that successful outcome. And last, you know, infertility is lonely. We all know that here on the call, and making sure that your insurance company provides you support along the way as you navigate this journey, whether that's support to find the right doctor or support to be emotionally supported because you just went through a miscarriage. Having somebody to talk you through that is so important. If you want to learn more about some of the resources that we have to help make those asks, we have some of those available. Just like Resolve has a work toolkit, we also have some resources available at Progeny. That's progeny.com/talk to HR, that you can find some resources there. And, you know, I think a few people have mentioned already kind of the reasons and why an employer would add fertility benefits. And you know, a lot of times I hear from people who have advocated that they're nervous, right, before they do it, and they're really scared. And we've all kind of echoed that on this panel. It is a scary proposition at first. And I think many times people believe that it's going to be self-serving when they're asking for a fertility benefit, right, that they think it's just for themselves. And I'm here to say that it's not just for you. It is for so many other people. It is leaving truly a legacy for other people to have fertility coverage. So try to get out of the mindset that you think it's just for you. It is for so many other people. And then there are so many benefits in it for your employer. It is my job to educate your employer why they should add fertility benefits. But what I'll tell you is, as you think about approaching your HR team, there's a few really kind of top reasons employers will consider fertility benefits. The first is to help attract and retain talent. That is the first reason that, you know, employers are adding fertility coverage. Second, it supports a family-friendly culture, right? Employers now today need to be seen as family-friendly, and this supports that. Third, it demonstrates a huge commitment to diversity and inclusion, making sure that we're supporting all paths to parenthood, regardless of what your path actually looks like. And last, you know, I think Erica touched on it, and I actually have used her article many times in my outreaches to employers. But, you know, there is a strong business case for fertility benefits. We do know that people do not have as good of outcomes when they don't have coverage. And there are many facts that prove that. If you ever need information on that, Progeny has tons of resources available for that. I'll share that anytime an employer explores fertility benefits with Progeny, we actually do a full analysis for them that we actually predict for them utilization of the product as well as the cost savings associated with it. So, you know, there is a huge opportunity for employer cost savings as well. So when you think about this, I just want to make sure that people are not thinking that it is a self-centered, you know, ask that you're making. It really, there's benefits in it for everybody. And I really know this isn't easy. I've been there, I've been on this journey, and we are here to help you any way that we can. And I think the last piece of kind of parting advice that I would have is to be confident in your ask. And, you know, advocating for change is never easy. And I just want to leave you with a quote from the late and great Ruth Bader Ginsburg, which is, "Real change, enduring change, happens one step at a time." So I hope that this panel has helped you realize just to take one step, and you'll be making progress.
Thank you, Amanda. I mean, that was probably the perfect close. Thank you. So I know we went a little bit over, but if anyone has any questions, feel free. You can either type them in the chat or, you know, unmute yourself and just go ahead and ask away. Otherwise, you know, feel free to reach out to any of our panelists. I know that they are all happy to help others get benefits, especially with fertility coverage. And as we know, it's so isolating and so many of us have struggled through it. And I can say that I am thankful for all of these women who have charged and led the way, so that I feel comfortable also doing the same and empowered. And I hope all of you kind of take away that empowerment as well. And if you have any questions, feel free to reach out to any of us, we're happy to help guide you through it.
Thank you, Christina.
Of course. All right. Well, thank you guys. We really enjoyed having you on and are so very grateful for your voice. And we hope to see you soon.
Thanks, Christina. Take care, everybody.
Yeah,
Take
thank you,
care.
everyone. Thank you, Christina.
Thank you. Have a good night.